So when we come to psychiatric emergencies, usually conditions that there is disturbed thoughts, effects, and psychomotor activity leading to threat to self. And when we talk about threat to self, we are talking about suicide. And then there's also threat to others. And that threat to others can be in the form of aggressive behaviors. So, for example, you come across, sorry to say, usually we use the term mad person on the street. And then the person is holding either a knife or a sharp object and then chasing people. So the person becomes a threat to himself because he doesn't have the mental capacity or ability. He can use that sharp object to injure himself. And then likewise, he can use the sharp object to injure those around him or her. So that is what we mean. So usually psychiatric emergency, usually they are acute. When we say acute, they are critical. And then they need immediate intervention or care. So we come to the characteristics of psychiatric emergencies. One, psychiatric emergency usually they affect families and need urgent care. We all will testify that we are from families or homes. So if your loved one is affected with that kind of condition, it affects the family unity or psychological being. And then the family will be eager to at least seek for or sort for help for the person, not be the family. And then as we talked earlier on, psychiatric emergencies are threat to the person suffering from the condition. And then they are threat to other people in the environment. And they are even a threat to the environment itself because of their destructive nature. They can go an extra mile to destroy valuable properties. Another characteristic we will talk about is so we talk about psychiatric emergencies being affecting one's social and occupational life. People with psychiatric or mental health conditions that are critical, usually it affects their social and occupational life. Social in a sense that they cannot maintain good interpersonal relationship. That is, they can't have good friendship with others. And then it would affect their daily working schedule. They are not in their good self to even think about going to work. And then now let's look at the reasons why we intervene during emergencies or psychiatric emergencies. One, we are talking about safety of patients, family, and the environment. Because of the destructive nature or the threat nature of our victims, if we don't do anything to restore safety in the community or in the family, it will pose a lot of danger to themselves, with the family members, and the environment as well. And another issue has to do with we want to reduce family loneliness or anxiety. because when our family members or relatives suffer from mental health or psychiatric emergencies, usually families become worried and they don't know what to do. So the need for interventions at least bring them some hope and then relieve them from their anxiety or worry they are suffering from. And then we are also trying to enhance emotional security of others. And if you are in a society and someone has a destructive or a dangerous behavior and then you don't do anything to bring that person back to normal, the person will be a threat to your source of security, and you wouldn't even want to come closer to the areas those people find themselves in. So those are the reasons why when we see psychiatric emergencies, we should do well to intervene. I hope the group is with me.
Yes, yes, we are
Yeah. Okay. So now let's come to type of psychiatric emergencies. So the most common type of psychiatric emergencies, one is suicide or self-harm. Usually, once a victim, someone with a psychiatric emergency or in a critical state, the first thing that usually comes to their mind is they want to kill themselves because there's so much pressure or psychological or stress overload on them that they wouldn't want to live or they can't bear the pain any longer. So what comes to their mind is one, they would want to end their lives. And then another type is one is violence. And then usually psychiatric emergencies, usually people with psychiatric emergencies are violent. That is violent towards their surroundings and then those around them, and then they are violent towards the environment itself. That is what we say they are destructive in nature. They would want to be aggressive to everyone coming closer to them because at that critical moment, they lack the ingredient of trust. And then they usually see people coming closer to them as those they can't trust. So they would want to react with aggression. And then any other things surrounding them. Usually, some of them they suffer from um, perceptual or thought disturbances such as hallucinations and delusions. Usually, they can see their mind plays them games that usually they are harmful or other dreadful these things on surfaces of um, surfaces or their environment. Maybe they come across a car and then there's a poster on the car, and they mistaking the poster as maybe either a snake or something that is threat to them, and they would want to kill that threat. So at the end of the day, they end up smashing the glasses of the car window. So those are the things that happen. And another issue it has to another type of psychiatric emergency has to do with stupor. So with the stupor, usually is common in people with schizophrenia. Schizophrenia has a lot of types or how we categorize it. And usually, when they are in the catatonic stupor state, they would become so quiet and still. Even if you come to touch them or do anything to them, they tend to be unresponsive. They are just totally down. But bear in mind that once they are unresponsive, any bad comment or any bad thing you do to them, it sticks in their memory. So when they move out of the stupor stage, they would be able to approach you and tell you that so and so time you did this to me. And then because of that, they can retaliate or harm you. So when dealing with such people, you have to be careful. And then we also have one time that is panic. So usually in a panic state, usually it happens that the person is just so worried. Usually the worry, sometimes there is no basic for that worry. They are so frightening or they think about an impending doom, that something bad would happen to them. And that's and in that state, they are not in their mental capacity to make the right decisions. And that can make them so dangerous. And another one has to do with people on substance, usually substance addicts. Addicts, when they are withdrawing from the substance or when they don't get the substance to use, they become aggressive. And usually it's not their fault. The substance, they take it for, we call something elation, for so extreme happiness. So when they don't get those substances to take, usually it affects their mood and then they can become very, very aggressive and destructive. Another one has to do with drug overdose. And nowadays, drug use is so common in our society, especially people taking the tramadol and other stuffs. They take those drugs and then it makes them so high, then they are out of their senses. So any bad or destructive thing they can do. And then we have something we call delirium. Delirium is just a form of confusion. And it could be confusion as a result of a medical condition, or it could be as a result of a substance, or it can be of unknown origin. And during the confused stage, the delirious patients can be so harmful and then can be a threat to life and properties. And then we have a condition called epilepsy or seizures. And epilepsy, even though it's a medical condition, but its impacts on the lives of the victims is so great that usually people with epilepsy develop some psychosis, that is altered perception about the reality of the world. And they turn out to develop hallucinations and delusions. And we are going to focus much on epilepsy, and then we would understand how epilepsy comes. Usually, epilepsy comes with warning signs. Let's talk about a generalized seizure or epilepsy. Usually, we have what we call the hour stage. Usually, people who are going to experience an epileptic attack usually would some will feel some unusual taste in their mouth, and then some would also experience some visual disturbances, and then some would even produce unusual sound we call a shrill sound. You can just shout "Woo!" and then all of a sudden they are falling. So we are saying that when you meet such a case or a victim, usually and you are closer and then you observe that the person is going to have an epileptic attack, you don't let the person fall on the ground like that. You make sure that you would aid the person safely onto the ground, making sure to protect the person's head, because the head is carrying an important organ called the brain. And it's because of the electrical impulses or uncontrolled electrical impulses that is causing the epilepsy or seizure. So when the person is in that state, your focus is to at least get something that is soft to pad the head so that the head would not hit the ground for the person to have a brain injury. So when the person, you finally succeed in getting the person to the on the ground, you can get a soft something to pad the person head, or you can just put the person head on your feet so that the head doesn't hit the ground. But when the person is going through the twitching, you don't stop the person. You allow the person to go through the seizure process. Because once you are trying to force or stop the person to go through the process, you can cause more harm to the patient because it's an electrical or involuntary activity. So you let the body physiology follow that trend. Your your duty is just to protect the person's head so that the person's head doesn't hit the ground to cause severe brain injury. And another point I want to make clear to you is that when a person is undergoing that seizure, usually we normally see a foamy like something coming from the mouth. Don't try to open the person's mouth or try to clean the distance. Just allow the person to go through the process. Because in the process of opening the patient's mouth or trying to put something in the patient's mouth, you can mistakenly block the person's airway, or something can fall back and then it will block the person's airway. And if the airway is blocked and then you don't open it immediately or quickly, the patient can go into what we call respiratory distress. The patient respiratory tract would be compromised. And you and I know that when your respiratory system is compromised, it can go a long way to affect the brain because the brain will be deprived of the oxygen it needs for survival. And once the brain is deprived of the oxygen it needs, and then the brain would die. And bear in mind that when the brain cells die, it cannot be revived. Even if we revive the patient can become a vegetable. When we say a vegetable, the patient or the victim can live all right, but the person would not have use. The patient will just be there. You have to do everything for the patient. Mhm. So when it comes to seizure, that is another type of a psychiatric emergency. And then when you are monitoring someone with seizure, you have to know the type of seizure the person is going through. Either the person is going through a generalized seizure or a focal. When we talk about generalized, all the body parts or all the brain sectors or hemispheres are firing the electrical impulses. And then you can see jerking and stiffness of the body. Another thing we will talk about is major type of psychiatric emergency is major depressive disorder. So major depressive disorders usually comes with most of them comes with some suicidal ideations. The person is so down or emotional broken down to an extent that the person has bad or weird thoughts of harming or killing themselves. And when you see said victims, it's an emergency that requires immediate intervention. And then we talk about drug adverse reactions. Usually, our psychotropic medication comes with a lot of adverse or bad side effects. And a major adverse or bad side effect is we call something extra pyramidal side effects. Usually, it affects those on the psychotropic medications, their muscles. And then you can see that when they take some of them, when they take it, their muscles around the neck area become so stiff, open them out. And then when you see those things, the person will need an immediate intervention. So you can refer the person quickly to the nearest facility for the immediate intervention. And then one thing you normally disregard or you don't talk about is stress overload. Stress is part of our daily lives, and then usually we go through a lot of things: stress of school, stress about our family, stress about responsibilities and other stuff. So if you are not able to manage your stress very well, it will get to a time that it can break you emotionally. You will either become so depressive and then you don't know what to do. And then when it comes to that stage that you get to the depressive episode, it can become an emergency, and then we will need to intervene immediately. I hope you are with me.
Yes, please.
Yeah, we are following.
Yes, yes. So now let's come to handling or managing psychiatric emergencies. Before you would manage an emergency, you would have to also make sure that you don't become an emergency. So that's one thing you have to put at the back of your mind. Before managing an emergency, don't become an emergency. Why are we saying this? We are saying this because usually you can encounter an emergency, and then you know that when you try to go into salvage the person or the victim, your life would be in danger. And anything you are doing, you have to think about yourself first. So before you handle any emergency situation, the first thing you have to do is to check for danger. Check your environment to see whether it's danger free for you, is danger free for the victim. And then before you would now start to intervene or call for help. If the scene is not so safe, and then you know you can remove the person from the dangerous scene, you move the person to a safer place and then call for help. So usually in emergencies, we don't usually want a single or lone intervener. We want that when you chance an emergency, you identify this as an emergency, then you would need to call for help. You either call those around you to help you, or you can call the ambulance service, or maybe any health facility closer to you to come to your aid. Because emergencies are can be so overwhelming that if you are trying to salvage the victims alone, you would also end up becoming an emergency. So another point you have to take note is that when you see an emergency, you have to be calm, and then you have to speak politely to the victim, because at that instant, the victim might not know their whereabouts, and then they might be so anxious, and then you have to be calm, be confident, and then speak politely. If you don't speak politely and then you are harsh to the person, you are going to worsen the plight of the victim. And then, as I said earlier on, you move the victim or the client to a safe place. And then you would have to provide some basic life support. If like the person is bleeding, as in our previous this thing, earlier submission, I said if you come across a road traffic accident or something like that, and then you see that the patient is bleeding, your number one intervention is to at least salvage the bleeding, arrest the bleeding, so that you can save a life. But when it comes to psychiatric emergencies, maybe you come across a mad person or someone with a mental illness or mental challenge person holding sharp or dangerous this thing, and you know that you can at least um, take those sharp items from the person, you do that. Or maybe you see a sharp object closer to the person. Your intervention is to at least make sure that the person doesn't get to pick that sharp this thing to harm others. So you would pick that thing away from the person so that you are trying to create a safe environment. So in such situation, you come across someone who is a threat to themselves or the environment. Ghana, we have a mental health act, that is the Act 846, that was passed by Parliament. Even when you come across a mentally challenged person, and you know that the person can be a threat to themselves or the environment, you have the right to at least go to the nearest health facility or the nearest health facility to seek for a certificate of agency. So the certificate of agency is that you are trying to pick a permit from the hospital, and then you can involve the Ghana Police Service to come to arrest that person, then keep the person in a safe place for onwards transport to a mental or psychiatric facility for proper intervention. Because when you leave such persons on the street, they would be a source of danger or threat to our safety. So the law grants you that right that you can involve the hospital and then involve the Ghana Police Service to at least pick the person to a place where they can keep the person safe for onwards transfer to a psychiatric or a medical facility that they can handle such cases. So now we are going to talk much more about suicide. So when we talk about suicide, suicide is a deliberate self-harm. So the person is intentionally doing something to either hurt themselves or end their life. So that is what we call suicide. And then suicide can be as a result of maybe the person is mentally overwhelmed and then the person doesn't have any other option. And the person just wants to end their life. So when you come across such a victim, the person need an emergent attention. That is a psychiatric emergency that you can refer the person to the nearest health facility for onwards intervention and then monitoring. And then we are saying suicide is common among psychiatric patients. Even though suicide is not only found in psychiatric patients, we are saying it's common among psychiatric patients because most psychiatric patients are mentally overwhelmed. And then it's a very challenging situation that usually they don't want, most of them don't want to live any longer. So they would do all means to end their lives or attempt suicide. And then suicide is common cause of death among service users. Then common among 15 to 29-year-old, and is the third leading cause of death in Africa. And then 1,500 to 1,993 annual deaths in Ghana, just from suicide alone. And then male dominate the suicide chart globally. Usually, females are sometimes afraid to carry out suicidal acts or activities, but males are more bold to commit suicide than females. And then hanging and chemical injections accounts to almost 70% of suicide deaths globally. So how do we manage? Let's look at the causes of suicide. One of the major causes of suicide is psychiatric disorders. When we talk about psychiatric disorders, usually major depressive disorders, that they are suicidal ideations. And then it's also common among people who uses drugs, because addiction is so overwhelming that sometimes people would go an extra mile of selling all their property just to acquire the substances they use. So when it gets to a stage that they have at least consumed all their property, they don't know where to get money to source for their illicit drugs. Most of them lose hope and then tend to commit suicide. And then we have another cause of suicide is chronic medical conditions. People with chronic medical conditions such as HIV/AIDS, because of the stigma attached to those conditions, would want to end their life, and they would try or attempt suicide. And then people with a terminal illness such as cancer would also want, most of them would also want to commit suicide. And then when we come to psychosocial factors, psychosocial factors such as poverty, failures in lives, and then loss of loved ones can also trigger people to commit suicide. And now let's come to the risk factors of suicide. And suicide, usually people who are prone to get committing suicide are people that are older than 40 years. And then as we said earlier on, males are more at risk of committing suicide than females. And then suicide is also common in people who are living a lonely life, in a sense that people who are somehow extroverts would have friends that they would share their daily problems, or trusted people they would share their daily problems with, and they would get good advice on what to do next. But people who are living lonely life don't have people that they can share sensitive information for advice, and they tend to commit suicide. And then people who have previously tried suicide are also more prone to attempting or committing suicide for the second time. And then there are people who are always so preoccupied with suicide. And those people, they are also at risk of committing suicide. And we talk about chronic illnesses. People who have chronic illness is a risk factor for committing suicide. And then loss of loved ones, drug dependency. So now let's look at the warning signs of suicide. One of the warning signs of suicide is constant sadness. Constant sadness. And then usually is constant sadness is usually common in people with depressive disorders, major depressive disorders. They tend to be sad almost all the time. And then people who are sad all the time can it can be show a clear signal that they would one day attempt suicide. And then people who usually speak about or feel hopeless. Anytime you are with those people, they don't have hope that things will change the next moment or Allah can change their plight for them. They are always constantly expressing their hopelessness. I don't think life is fair. If I die, it's better. Those kind of statements, you don't have to take it lightly. So if you have a friend or a relative who always express those kind of words, you need to be careful or monitor them or maybe let them seek for psychological support. And then people who usually they isolate themselves, usually is common among depressive patients. Because of how they are mentally broken down, they tend not to try to mingle with people. And those people usually have trust issues. And then always if there's a gathering, they would want to be alone. They don't want to come closer. And then if you see someone who has been an extrovert and then later you observe that the person is now trying to be an introvert and then try to dissociate himself or herself from you, it could be trying to commit suicide. And the people who sleep too much or sleep too less. And one thing about depression is that it can alter your sleep pattern. You either sleep too much or you sleep too less. And then if you see someone and then the normal pattern of sleep has changed, you would have to interrogate the person in a more friendly or calm manner. Then ask the person the kind of problems or challenges they are facing. And if it is beyond your control to advise them, then you would refer them to someone who has a psychology background or a psychiatric for early intervention because those signs could be a warning sign that the person might be thinking of committing suicide. And then people making statements like, I wish I was dead. Usually the funny thing about suicide is that usually people usually prompt or give us a prompt that they have the suicidal ideations. Oh, the way life is treating me, I wish I was dead. That if I die, it will be better. Never take those statements lightly because the person saying that might be planning or the person has even bought a poisonous chemical to take and then trying to communicate his or her feeling to you, at that moment the person would just want to hear your opinion, but the person doesn't have that capacity, or the person doesn't have the willpower to come boldly to you that, oh Charlie, the way life is treating me, I'm planning of harming myself. No, but the person is giving you warning sign. So if you hear those kind of words or statement from a friend or relative, don't take it lightly. They might have intention of committing suicide. So you would have to refer the person to the appropriate body for intervention. And then another cardinal sign is that people planning suicide will usually give away their possessions. Because after all, oh, I'm going to die. After all, I don't want to live any longer. So the person would start sharing their property, valuables. The person has money in the account, the person goes to withdraw, and then just be sharing the money, because at the end of the day, maybe in the next 30 minutes or 1 hour, I want to kill myself. So those properties, I don't need it. So the person starts to dispose the property. So it can be a warning sign that the person might be trying to commit suicide. And one funny thing too is that people planning to commit suicide mostly tend to neglect their personal hygiene. Usually, a sound person, on a daily basis, you will be thinking about how to care for yourself. You wake up, you think about bathing, you think about cleaning your mouth or brushing your teeth. And then you think about putting a nice attire on. But someone who is planning to commit suicide, he doesn't even have that mental capacity to think about um, uh, maybe waking up and planning to bath and then trying to dress. No, the person doesn't have that willpower again. So if you see someone who, although the person is a neat person, and then the person all of a sudden start to neglect the personal hygiene, he doesn't want to bath. He can stay 1 week or so and then he won't bath. He doesn't care about what he puts on and then blah blah. The person, that would be a warning sign that the person might be planning to commit suicide. And then let's look at the misconceptions about suicide. Um, People usually have misconception or tell lies about suicide. And then one of the funny lies they talk about suicide is people who talk about suicide don't complete it. It's a lie, usually it's a lie. As I said earlier on, when someone tells you that I want to kill myself, no, I don't feel like living any longer. And then you think the person is just saying it, the person cannot act. You would be surprised if you don't intervene early. Maybe the person has already bought the rope that he wants to use to hang himself in the room. So just a little chance that he observed that no one is around, he can just tie the rope and then hang himself. He has already communicated he wants to kill himself, but you didn't take the action to salvage
Mr.
that
Speaker,
person.
you
And
have
then
3 minutes.
another talk about suicide that people who attempt. I have 3 minutes.
Now,
Okay. I think I'm almost done. People who attempt suicide wait to want to die. No, it's not true that when someone attempts suicide they want to die. They don't have that mental capacity, at least to talk to someone. They don't have that vim or energy to talk to someone. So they would feel like they are not they don't fit well into the society, so they want to end their lives. No warning sign of suicide exists. No, it's not true because we said it that there are warning signs of suicide. Nothing can be done about people who wish to die of suicide. It's not true. All those who attempt or commit suicide are mentally ill. It's not true because we said earlier on that people with chronic medical condition or terminal illnesses such as cancer can also commit suicide. Once suicidal, you are suicidal forever. It's not true. With the right intervention or guidance and counseling, it can change people's perception or suicidal ideation. So now management of suicide. So we have to identify suicide signs early and act quickly. That is very important. Identify signs early and act quickly. Then you monitor patient safety needs. You have to monitor how patients the environment they are living in, are they living in a safe environment? Are they susceptible to acquiring sharp or dangerous things to harm themselves? So you have to monitor those things. And then you have to seek for psychiatric consult. And then you have to also seek for guidance and counseling. And then early medical and psychiatric care. So I think the rest there we already discussed about those things. So Alhamdulillah.
MashaAllah.
Mm.
Alhamdulillah. Thank you very
So
much, brother. And
those are the little these
we
things I will share with you.
uh, we really learned so much from your presentation. In fact, this has been a very massive lecture, and we are very grateful and we appreciate. Thank you very much once again. I would like to invite all the audience to throw their questions. They should bring their concerns, contributions, corrections, anything they want to say, their comments, and all that. Our speaker is still around. You can ask any question, and you have 10 to 20 minutes, but less to do that. So the floor is open to everyone.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'm your brother Salih, and my each question goes to our speaker. What if there's this person he had made previous attempts, but not successful? But you've seen that anytime, like you is now putting people onto stress that you have to always stop him whenever he's making the attempt, and he has been making multiple attempts. How do you tackle such a person? Please, I hope my question is heard.
Yes. So you have someone who has attempted suicide multiple times, right?
No, but incidences of such incidences had occurred, and we've heard that some people have multiple attempts and they're not successful. That's what I'm asking.
Yes. So and in tackling those situations, usually you would have to identify the root cause of the suicide or suicidal ideations. Is it that the person has an underlying psychological problem or a medical problem or psychosocial problem? So if you are able to identify those contributing factors to the person attempting suicide, and then you tackle it bottom top, you would be able to succeed in at least curbing the person from attempting or committing suicide. For instance, the person has issues with finances, or the person has failed in an exam, and then he has uh, realized that he has lost hope. And then you don't refer the person to a psychologist or a guidance and counseling person for the person to elicit the information what is tempting that victim to commit or attempt that suicide. And then you just leave the person like that. The problem has not left, or the thought has not left the person's head. He would keep on continuing to attempt that suicide until the right interventions, he has received the right interventions. The suicidal ideations will still exist. I hope that answers your question.
Yes, thank you very much.
Okay.
Any question? All right. So if you have a question or anything, you can go to the comment section and then comment or write it there. I will read it out for everyone. I would like to call on our CEO to give us a summary of how the organization is being run, how progressive it has been. Just a summary and a quick one. So Imam Kamali, kindly tell us. Please, can you hear me?
Yes, please.
Hello.
Yes, I'm coming. Just still,
Hello.
now I'm headed.
Now, so Imam Kamali.
It's just a minute.